requires renovations, so that the members can take note and only be passing the budget. Perhaps they'll be considerate and they'll be taking care of these facilities. Number two, Mr. Speaker, we also have the reports on the load, on health facility load connectivity for primary health care facilities. Mr. Speaker, some of the roads are in the pathetic conditions, especially the roads that are leading to these facilities. And those roads...
Chair, before you proceed to the next report,
yes,
what you're doing is inviting the members to take note of the needs of the health department, that is in as far as the health facilities are concerned, so that now every member from every ward can be able to see exactly what their wards or their health facilities need to be considered in the coming financial year. That is what you're inviting the members to do. So then, Chair, you may want to invite the members to have the printed or the hard copy, or maybe the members can have specifically the pages that are indicating their wards, to be able to know exactly what facility needs what and what the amount of money is needed to that. I think that will be a proper direction, Chair.
Thank you, Mr. Speaker, for your direction. Precisely, that's what is expected of the members, and I believe that the table clerks are going to make sure that the members are going to have these copies. And specifically, if it means every member with their wards, respective wards, it will be most actually prudent to do so that these members can take notes and they can at least have some information or other data as far as the status of their facilities are concerned, so that they can proceed in doing the necessary as well as appropriating funds to go to those facilities are concerned. Therefore, Mr. Speaker, I would wish to table this report as well as the status of renovations of the facilities are concerned. Number two, Mr. Speaker, we also have a second report concerning the roads. And Mr. Speaker, we are aware that there was a lady somewhere that was saying they are giving birth on the roads just because they cannot be able to access the facilities. And therefore, the department, once analyzing the challenges that these facilities are facing, they considered also looking at the status and accessibility of their facilities. And therefore, Mr. Speaker, all the facilities that they have roads that have some challenges have been identified, including where I come from, Mr. Speaker. They identified with one called Kapsita, where they say there is no road. It is 7 kilometers from the tarmac road, and they say there is a need for something to be done. Mr. Speaker, we also have a place called Mauche. We have Toyotich Dispensary. That is, it has a challenge of 200 meters. We have Njoro Ward, or we have Mwegitio, 4 kilometers. To go to that facility, or even to rescue a mother from that facility, we need a proper roads, Mr. Speaker, because we have some ambulance, and those ambulance, even when they are called for referral issues, they cannot be able to access those facilities. And it means then we'll be prioritizing ourselves, having appropriated a lot of resources to go to health department, but yet we do not have roads that are leading or are connecting to our facilities. Therefore, Mr. Speaker, it will be prudent if members will also be considering checking on the status and also improving the roads that are leading to those facilities, and they have outlined. If you go to, for instance, also Moro sub-county, we have Rawina, a dispensary in Marioshoni, which actually it has a rough road which is inaccessible, especially during the rain seasons. It has a lot of potholes, and it is 7 kilometers from Njoro Moro tarmac road. It means for somebody to be failed or rather to be rescued, a mother, a child, or an emergency to be attended to by an ambulance from actually control center, it is a challenge, especially during this time that it is raining. We also have Oljorai in Elementator Ward, which is actually a Laf Road, which is 7 kilometers from Kiambogo Center via Oljorai. It's in pathetic conditions. We also have 10 kilometers in Kiambogo Dispensary, Mitimingi, and so on and so forth. Mr. Speaker, all the sub-counties have been outlined, and I believe these members are going to have at least ample time to check on it. Mr. Speaker, if we go to Kurusoin South, which is in Tinet Ward, we have Tinet Kapkoi Dispensary. There is a lot of challenges there, and it has been noted that the load that is leading to that facility, it actually is not accessible, and even the members of the public cannot access that facility. And therefore, we request, and we humbly request, that when the members will be appropriating funds, they consider that, Mr. Speaker. We have Amaro Ward in Chapakundi Dispensary, which actually it also has some challenges, and our wish is that all the members, when they check and they take this report, they check on it, they consider, and they put a lot of emphasis onto this, because these are high-end roads, and these are the county roads that we really need them to be improved, and their status to be improved, using the ward funds, so that at least we can be somewhere. Mr. Speaker, we also have in Subukia, we have Kabazi Ward, which we have Gitura Dispensary, which has a stretch of 500 meters from Mungedo to Gitura Dispensary, and it has some sharp rocks at some section of the road, and also there is another section of 5 kilometers from the tarmac, which has a lot of challenges. Therefore, such kind of challenges are hampering even the appearance, Mr. Speaker. And therefore, Mr. Speaker, for these members to be felt that they are working, for these members to be seen, they are doing something to the community. Allow me, Mr. Speaker, to move that they consider giving the loads to these facilities some resources, so that at least by the end of the next year, or rather in the mid-next year, we'll be having some reasons to smile, and even to say that we have done our level best to facilitate these health facilities to be accessible, so that the service delivery can be accessed. Mr. Speaker, allow me also to say, health is unique, and health is universal. If today we are going to have an accident, and God forbid, and I'm somewhere in Marioshoni, Mr. Speaker, the first place I'll be taken for emergency, it's Marioshoni Health Center. Mr. Speaker, if there is no road actually from the point where I am to that facility, I'll find it tough. Therefore, Mr. Speaker, let us resonate in that line, and let us take that trajectory, so that we can have that bearing that we imagine ourselves being into such kind of scenarios, whereby Wanjiko is, so that these roads can at least be improved, and so that, Mr. Speaker, we can be able to have proper and appropriate service delivery that commensurates, or rather that resonates with the century that we are in, Mr. Speaker. Therefore, Mr. Speaker, I beg to move and request this honorable House to be considerate and to consider appropriating funds to go to these ventures, so that our wards can improve. Therefore, Mr. Speaker, I beg to lay.
Thank you, Honorable Chair. The reports are properly laid. So members, you are encouraged to get the condition or get that part of your facilities. That is that page that indicates your facility and the condition of your health facilities. And also there are access roads. Those reports are available. You can liaise with the clerks at the table after this session, and you'll be able to be supplied with the reports. Next order.
Order number 6, notices of motion.
There are no notices of motion. Next order.
Order number 7, statements.
Next order.
Order number 8, motion.
No motion. Next order.
Mr. Speaker, sir, those are the orders of the morning sitting.
Honorable members, this House is adjourned to today, 2:30 p.m. Thank you.